At the Roselle Center for Healing, we care about your health and want to help you take your health in a new direction, far from drugs and surgery. Knowledge is the key to optimal wellness and control of your health. We offer free health education on chronic health conditions and natural integrative medicine treatments. Register for free today.
Attend Is Sugar Still Public Enemy Number 1 on Wednesday, May 21st at 6 p.m. Space is limited, so register today. Call 703-698-7117 or visit rosellecare.com.
The information provided on Dr. Tom Roselle Live by Dr. Tom Roselle, D.C., interview guests, show co-hosts, or substitute hosts is not intended or implied to be a substitute for professional medical advice, diagnosis, or treatment. It is for general information purposes only. Information from this broadcast should not replace the appropriate consultation and examination process by a licensed physician. Always consult your own physician prior to changing any current medical directive or prescription.
This is Dr. Tom Roselle Live on 105.9 FM WMAL.
Welcome, everybody. This is Dr. Tom Roselle. You listen to Dr. Tom Roselle Live, as you do every Sunday at high noon in the Washington metropolitan area. We're right here on WMAL 105.9, and we're going to get into a little subject today that most of you are going to say, what? What's that all about? And it's called glycation. But I'm going to back it up because the actual program is about blood sugar transport. On the 21st of May at the Roselle Center for Healing in Fairfax, Dr. Scott Lamp and I are going to tag team. We're going to be talking about sugar, public enemy number 1. It still is. And we're going to tell you what all the damage it does and how you can begin to modify it. And as we get into the second part of the program and talking about sugar and its formation of glycation, we're going to second part, our live stream, we're going to touch upon what happens in the cases of significant Alzheimer's and cancers and things of that nature and cardiovascular disease. But I want to set the stage for it right now. And I'm going to give you some very specific, oh my God, I didn't know that exists type of thing. But it does, and you need to know about it. And it's important that, you're aware. And, I'm sorry I'm doing this to you today because it is it's Easter Sunday. And, all the eggs and the candies and the chocolates and all that stuff come about. And I don't mean to be, kind of a wet rag on everybody's party today, but you need to know. And then I'll let you decide what you can do. And if nothing else, you may have modified the consumption and you actually went and had some lamb or some turkey or some, whatever it is that you're enjoying with your family. I know I'm not a kind person sometimes, but let's get into the program and talk about this. But circle the date. May the 21st, May 21 at 6 p.m. at the Roselle Center for Healing in Fairfax, Virginia. Join us. All you have to do to register is go to drtomroselle.com, register there, or go to RoselleCare, RoselleCare.com, and register. The only thing we ask for you is that if you can't make it, let us know. So we can adequately prepare for those of you who are going to come. And as you know, these programs are full of data and full information. They're very usable, and we enjoy sharing with you. So let's get into this craziness that we're talking about and talk about the effects of sugar on different body processes. First of all, one thing that I want you to remember is this: the amount of sugar that's out there is like crazy. You're talking about 160 pounds of sugar per person per year. That's 160. And, back in the day when this country first became a country, the consumption of sugar was very much like a condiment, like salt and pepper and garlic and thing. Most people consume something in the neighborhood of about 17, 16 pounds. So how did we go 10 times that over a period of many years? And then we look at the disease processes that come about because of that. But let's talk about, sugar, still the number 1 public enemy. And that's, by the way, the topic that we're going to be pursuing on the 21st. Dr. Lamb came up with this some years ago, and we've kind of reinstituted it over a period of time. But sugar, public enemy number one, it still is, and we want to make sure that you understand that this situation, if you catch it early, is easily rectified. When we go into the second part of the program, we're talking about what happens when you have eaten so much sugar over time and you look in the mirror and you wonder why you're old and why you're wrinkled and why you have blotchy skin. All of that has to do with a thing called glycation. And we're going to explore that significantly in the next segment on our live stream. So make sure you join us. So let's talk about, what happens when you consume way too much sugar. And it contributes to health problems, right? It does. Absolutely, positively, you bet it does. And, if you say, no, it doesn't, well, guess what? You're in dream world and la la land someplace else. But besides weight gain and getting too fat, sugars or anything that turns into sugar is going to do that, because you can only use so much sugar that converts into energy, and the rest of it does what? It gets stored. It gets stored into lipids. Lipids are what? Fat, and then it continues to perpetuate things like diabetes and heart disease and dementia. Alzheimer's. Yeah, I hate to tell you, but increased risk of gout as well, and the list goes on. But here's the other piece, and then we're going to talk about that a little bit more later on, is your dramatic increased risk of cancer. So if you want to avoid a lot of this stuff, you want to know how to transverse through this, you want to find out if it's destroying your joints and breaking down your health and what you can do about it, then join us on the 21st of May. And we're going to give you a lot of tools. But let's talk about, the problem, if you will, of consuming too much sugar in your body. And it's in everything. It's across the board. Why? Because all the manufacturers know that it's addictive as hell. And you're going to eat a little, then you want a little bit more, then so forth. But too much sugar can be one of the greatest threats to cardiovascular disease, period, end of story, just the way it is. And, you're going to need to know how to deal with that. But sugar has a bittersweet reputation, if you will. Interesting play on words, right? Bittersweet. Sugar is a natural occurring substance in nearly all foods, and that the foods that contain carbohydrates, not protein, but things like fruits and even certain vegetables, grains, dairy, absolutely. And consuming whole foods that contain natural sugar is sometimes okay, as long as you're not over consuming and that's all that you're getting in your system, and you don't have the calorie burn to get rid of that buildup. So plant foods have high amounts of fiber, essential minerals, antioxidants. Dairy foods contain protein and calcium, but you have to look at the type of substances that they're made out of. So if you get a plant food, right? Now, leafy plants is one thing. Corn and potatoes and rutabaga and so forth. Those are different types of plant foods. They're plants. They grow on the ground. But they have high carbohydrate levels, and those high carbohydrate levels do what? They convert into sugar over time. Now, they also have minerals. So if you get green leafies, you get broccoli and asparagus and, the any kind of leaf vegetable and so forth, you got high levels of essential minerals. And they're really good for you. They also have, in certain ones, have a little bit of trace proteins and the like. Your body digests foods very slowly, and sugar in these foods offers a steady supply of energy to your cells in adequate amounts and not too much. But when you get high intakes of fruit and vegetables that have a lot of starch to them, and whole grains, even though they're good for your whole grains, you have a double-edged sword. One, you increase your risk of diseases such as diabetes, heart disease, unless you're buffering them with proteins. But you also, because of their whole foods, their balanced foods, you'll decrease the risk compared to other things. So that's how you have to look at that. it's not that they're bad for you. It depends on the levels of consumption. It doesn't mean that they're good for you. It depends on the level of consumption. The problem occurs again when you consume too much sugar from any source in the body. So if you're a sweet potato guy, you're probably not, and you have a sweet potato 2-3 times a week, you're probably not going to get in trouble. If you're eating wild rice, you're probably not going to get in trouble. If you're eating black rice, but you got to make sure that you have a lot of vegetables around that, protein substances and so forth, and your diet is balanced out. But if you sit there and you keep adding sources of carbohydrate that convert into sugar, guess what's happened? First, you can get fat, because your body can't burn it all up. But when you look at the good old American diet, and we're looking at, the soft drinks that we have, tons and tons of sugar, fruit drinks, that's fructose, the flavored yogurts, that's sugar, cereals, take a look at the sidebar, cookies and cakes and candies and processed foods and so forth. It's not okay. I just came back from teaching in Italy. And you know what I noticed, which was really interesting? People are not fat there like they are here. And even though 21st century has hit that area, they're not as bad as what we see walking around in this country. Why is that? A couple of reasons. One, their food is cleaner than ours. It's not inundated. They don't have a lot of added stuff to it. They don't inundate it with tons of other sugars. They're natural sugars. But they eat smaller amounts, and they eat proteins, and they eat vegetables. And if they have fruit, it's a little bit on an occasion at the end of the meal. It's not the centerpiece, if you will. So when you see these people, you have to say, why is it so different here? Why are things different? You see people walking. I was at my cousin's house, and I was going to come back later on that evening for dinner. I said, I just feel like walking. How far is it to my hotel? And he said, oh, it's very, very close. He said, 2 kilometers. Well, we're talking about what, 1.65 miles of some sort, right? For them, that's not far. That's nothing. They go out and they just walk and they stroll. And I was in that place. I wanted to go for a walk, and I just walked, and I watched a lot of people walking, and they walk quickly, fast steps. This is in Milan, Italy. But excess sugar impacts on a lot of different things. Obesity, ultimately predisposing to things like diabetes. And when you know that's true, there's a problem. Sugar increases your risk to dementia, particularly Alzheimer's disease, because it causes something called glycation, which we're going to get into the next part of the program. But glycation is caramelization, and it attaches itself in the wrong places. So we're going to talk a little bit more about that. And on the 21st, we're really going to get into this. But in a study, an interesting study in JAMA, Journal of American Medical Association, Internal Medicine, I think this goes back, let me see if I can pull it up while I'm sitting here. 2014. Yep, see, my computer still works. And there's a guy by the name of Dr. Hu. He had a research group. They found the association was extremely high between a sugar diet, increased sugar diet, and a greater risk of dying from heart disease. Now, that came straight out of Harvard. So if you want to increase your risk of heart disease, and those of you that were unfortunate enough to have a COVID vaccine, and we know that we're seeing tons of pericarditis and myocarditis, I wouldn't encourage you to just arbitrarily eat as much sugar as you want, because guess what's going to happen? You are going to be potentially at a greater risk of dying from heart disease than somebody else was. So cut it out already. Stop, right? So this study, by the way, was over 15 years, and it showed that people who got 17% to 21% of their calories from added sugar, and I'm quoting directly from the study, by the way, had a 38% higher risk of dying from cardiovascular disease compared to those who only consumed about 8% of calories from added sugar. That's crazy. Think about that. And then look at your packages that you're doing. If you go back and PBS did a 90-minute documentary on my work, I think it's been probably about 14 years ago now. And one of the things at the end, what we did is we encouraged people to eat from the perimeter of your grocery store, not the packaging, but the fresh foods. And if you did that, just doing that, and we didn't even tell you what to eat, we just eat from the perimeter. And we made a statement that you would exponentially drop the risk of so many different types of things. But here's one just straight up, right? And here's a study that confirmed that. And this was after I did my program, by the way. And so, how sugar actually affects the heart and is not completely understood, with the exception of this. And it causes an inflammatory reaction. It causes that thing that we're going to talk about a little later called glycation, but appears to have several indirect connections. For example, high amounts of sugar can cause the liver to be a problem for you. So why is that? Well, your liver helps metabolize sugar. So there's storages in the liver and your muscles called glycogen. Glycogen is triggered to be released and converts into glucose. Glucose is what your body uses in the engines called mitochondria to give you the get up and go that you want. And it happens like alcohol too, by the way. So if you're drinking alcohol, you're kind of blowing this thing apart. And it converts into carbohydrates. Carbohydrates go into fat. And so it's a vicious cycle because you can't use it up. So consuming too much added sugar raises blood sugar and increases this inflammatory reaction. Inflammation, which is acid to your body, which causes degeneration, which spikes your body to a place of trying to protect itself, and it puts stuff in, including fat and so forth. And it's an interesting study. But what I want you to get is that if you're eating sugar, you might as well cut your wrists and bleed slowly, because that's what you're doing to your body over a period of time. Now, an occasional, I'm going to go out and blow it today is not what we're talking about. Everybody can be dumb once in a while and, recover from it without. It's the chronicity. It's the ongoing process that causes the potential of cancers and neurological degeneration and joint degeneration, increased risk to arthritis and heart disease and so forth. And it's public enemy number one, straight up. And we're going to show you what the signs and symptoms are of that on the 21st. We're going to show you, say, hey, listen, your body's already telling you that. When I get into the second part of the program, we're going to tell you what your face looks like when you're eating too much sugar. Maybe a little bit of plaquing here and there on your face. It's called glycation. We'll talk about that a little bit later. So how much sugar is okay? Well, if 24 teaspoons of added sugar per day is way too high, and by the way, that's fact, you can't really say, how much sugar is really required on a day-to-day basis. But I can tell you this, you don't want to get sugar added to your diet. You want to get it from natural sources and only up to a certain level. So you go to the American Heart Association, which I don't always agree with, and they're saying that, women should consume no more than about 100 calories, about 6 teaspoons of sugar from sugar, right? And men, maybe 150 calories, and that's 9 teaspoons. I think that's too much. And because you're getting sugars from other things as well. You're getting sugars that break down in info. So you put that onto a diet that's really high in carbohydrates, the potatoes and the white rices and the pastas and things like that. And you just exponentially increased everything. So what is sugar? You like brown sugar and corn sweetener and corn syrup and fruit juice concentrates, high fructose corn syrup, honey, inverted sugar. It's called invert sugar, malt sugar, molasses, and it goes on. You could, anytime you see the O's, right? I used to do a program called the Story of O's, like the Story of Oz. Well, it's called dextrose and fructose and glucose and lactose and maltose and sugar and sucrose. Those are all sugars. If you see that on any box, you got added sugar. So total sugar, right? Total sugar is, added sugar, if you will, and including that is often listed in gram portions, but you want to keep it as low as you can. Your diet should be natural sugars from things like sweet potatoes and wild rice. You want to have protein. When you look at your plate, 1/2 of that plate should be good vegetables. 1/4 of that plate should be starchy something. 1/4 to 1/3 of that plate should be protein. So you have to make sure, that you are aware of what it is you put in your body. How about those of you, go down to Starbucks or any other coffee shops and you get your favorite latte? Added sugar comes from all kinds of things, right? Your coffees and your teas, because you're sitting there and you're making milkshakes out of these drinks. Tons of sugar. In Italy, that's the other thing that I don't understand. They love their espresso. And you watch some of these people and they put, is there more coffee or more sugar in this thing? And, you're putting like 1 or 2 teaspoons, but that's how they get their consumption. They rarely eat anything else when it comes to sweeteners, unless, they're modernized. And then take a look at their waistline. And then you say, oh, wow, we got a problem here. But again, just to give you a clue, if you're reaching for foods to satisfy your sweet cravings, like refined starches of any kind, white breads, white rice, they can increase your glucose level. And if you're not burning them up, they go into storage. And what do? They store as fat. And if they cause inflammatory reactions, okay, inflammation, acid, remember inflammation, acid, your body has to put the fire out. So how's it going to put the fire out? It does 2 things. It's going to put other fat into it that you naturally make. It's called cholesterols that come from your liver. Your liver makes them. You can't stop it. You need them. But it's also going to do what? It's going to take a alkalinity and alkaline storage, which is calcium, comes out of your bones, and it goes into buffering that acid that's there. That's because of the sugar that you're eating. But, you're talking about things like sodas and energy drinks. They have huge amounts of sugars in it. Grain-based desserts, fruit drinks, dairy products, candy, ready-to-eat cereals. You take all the old box of Cheerios out. By the way, it's really funny. You take a box of Cheerios here in the United States, and you take a box of, cereal that's sold in Europe, and it isn't the same, my friends. Look at the sidebar. It's like crazy. You can look it up on the computer. It's really say, oh my God, I didn't know that, right? Your yeasty breads, teas in the South, sweet tea. Everybody's got this damn sweet tooth, and they just won't stop it. And they wonder why they're too fat. They wonder why, their brain's not working. They wonder why they have heart problems and they got cardiovascular disease. I'm telling you, the greatest reason for it. So on the 21st of May, please join us. Dr. Scott Lamp and I will tag team. We'll go back and forth. We're going to teach you about, what you should be doing. I'm not telling you never, ever, ever. I'm saying understand what they're doing so you can get rid of this crazy dietary process. And guess what? You might do something else. It's called go for a walk. Did I tell you work out? I said, just go for a walk. Get out and walk. If you got 2 blocks to the store, don't get in the damn car. Go for a walk. Get out there and, burn up some calories. Burn that stuff up. Because if you don't do it, you're going to lose your mind, literally. It's called Alzheimer's and the creation of tau proteins from it. And we're going to get into a little deeper into the subject as we go through in the next segment on Ageless Health with yours truly. And by the way, all those are available. You go to drtomroselle.com. And by the way, if you want me to do this for you publicly, meaning for your groups, for your people, we work through our foundation, Caring for Others, and we're happy to send one of our doctors, or yours truly, if I have the time on my schedule, and present anything that you'd like to. So all you got to do is call the office, get a hold of Sybil McFarland, and we're glad to do that for you. So we're coming up to the place where we're going to shift to the live stream. But put this in your head. Remember, added sugars, total amount of sugars that you're not burning up, go into storage, and they clog things up, and they cause your brain to be able to not function. It causes the cancer to be predisposed. It causes a lot of things you don't want to have happen to you. Remember, I'm here every week for one reason only. You deserve it, but also I love you all. See you in a minute.
Breast cancer is a major health risk to all women. It can silently grow uninterrupted for years. The Thermography Centers of Fairfax reminds all women to conduct monthly and annual breast exams. Consider a thermography scan from the Thermography Centers as an adjunct to your routine breast exams. Digital infrared thermal imaging is safe and non-invasive. For more information and to schedule an appointment, call 703-520-7591 or visit thermographycenters.com.
Neuromuscular dentistry is more than just teeth and...
At the Roselle Center for Healing, we care about your health and want to help you take your health in a new direction, far from drugs and surgery. Knowledge is the key to optimal wellness and control of your health. We offer free health education on chronic health conditions and natural integrative medicine treatments. Register for free today.
Attend is Sugar Still Public Enemy number 1 on Wednesday, May 21st at 6 p.m. Space is limited, so register today. Call 703-698-7117 or visit rosellecare.com.
This is Dr. Tom Roselle. After 43 years of practice and over 1 million patient visits, the Roselle Center for Healing knows what works and knows how you can take control of your health and wellness. My team of doctors practice 21st century integrative medicine. Whether you suffer from chronic pain and fatigue, allergies or headaches, we can help. Take charge of your health before it's too late. Make an appointment today. Call 703-698-7117 or visit online at rosellecare.com. That's rosellecare.com. Neuromuscular dentistry is more than just teeth and gums. Neuromuscular joint disorder can be painful, and only a skilled neuromuscular dentist can diagnose and treat it. Hi, this is Dr. Tom Roselle, host of Dr. Tom Roselle Live. If you're in pain and suffering from TMD, call the neuromuscular dentistry experts at Soft Touch Dental Care. Learn more about TMD and how Dr. Michael Chung has successfully treated his patients. Visit softtouchdentalcare.com or call 703-319-6990.